आपने जिस व्यक्ति को कॉल किया वो दूसरे कॉल पर व्यस्त है। हेलो।
हाँ, क्लिक ऑन हो। नहीं, लाइव तो नहीं दिखा रहा है। मेरे को स्टार्ट तो नहीं दिखा रहा है उसमें। अच्छा, ओके, ठीक है, ठीक है। Hello, good evening, everyone. Good evening, good evening. Am I audible, visible properly? Am I audible, visible properly, guys? Good evening, good evening, good evening, good evening. So sorry for being late today. Good evening, Ishwar, Pooja. Hello, good evening, everyone. Raj. Good evening. Good evening. How are you all? How are you all? How's the preparation going on? Hmm? How's the preparation going on, guys? How's the preparation going on? Hmm? Only I think 2 weeks are left for your examination, GPAT examination. 2 weeks left. 2 weeks more. Uh, just I have to say that whatever you are studying right now, just go with the flow and try to revise the thing as much as possible, right? Don't think of कि अरे वो रह गया ये रह गया I have left this much I have left that much I have left studying this subject I have left studied that topic. So don't look onto that right now. If you still want to, you can continue for 5 more days, but after that don't do that. Okay, try to revise whatever you have studied. All right. Chalo guys, so in this video, in this live session, we will be having marathon class of the human anatomy and physiology complete syllabus. All right, so let's start then. Let's start then. Okay, chalo. Okay, so first question, guys. Which cytoskeletal element is involved in muscle contraction and cellular movement? Okay, which cytoskeletal element is most involved in muscle contraction? You know that muscle contraction and cellular movement. Which cytoskeletal element? Is it going to be the intermediate filaments? Is it going to be your microtubules, microfilaments, or centrosomal fibers? What is that, guys? Which one? Which one is the correct answer? Tell me first. Tell me first. Which cytoskeletal element is most involved in muscle contraction as well as the cellular movement? Right? So intermediate filaments, microtubules, microfilaments, centrosomal fibers. Which one is it? Hmm? No one going to answer? No worries then. So that's going to be your microfilaments. All right, microfilaments. And here you can see the cytosol and cytoskeleton. The cellular matrix is collectively referred to as the cytosol, right? An extensive intracellular network. Whatever network is being present around the cytosol, that is your cytoskeleton. Network of tiny protein has been called cytoskeleton, which is of three types: microfilaments, microtubules, intermediate filament. Microfilaments to help the muscle contraction. Here you can see muscle contraction maintain the shape of the cell and help cellular movement. Microtubules provide stability to the cell, right? They prevent tubules of ER from collapsing. Intermediate filaments, they play a role in cell to cell attachment and help in stabilize the epithelium. They provide the strength. Okay, chalo, next question. Which one is incorrect about the mitosis? You know that there is a kind of cell division in which you will be having mitosis as well as the meiosis, right? So, which one is incorrect about mitosis and meiosis? So, mitosis introduce genetic variation, meiosis is related to the sexual reproduction, mitosis is related to growth and repair, or meiosis reduces chromosomal number. Chalo. Simple, very simple question. Chalo, tell me in this comment section, guys. What should be the answer? What should be the answer, guys? Hmm? What should be the answer? Chalo, come on. Mitosis introduces genetic variation or related to sexual reproduction, related to growth and repair. Meiosis reduces chromosome number. Hmm? Which one is it, guys? Yes, Chaitanya is right. The mitosis introduces genetic variation. That's an incorrect statement. Meiosis related to sexual reproduction. Yes, that's right. Mitosis related to growth and repair. Yes. Meiosis introduces chromosome number, reduces the chromosome number. All right. So this is the difference between mitosis and meiosis. You should be looking onto that. Right. Chalo. Next question. A person is having antibody A. Okay. A person is having anti-A antibody in plasma belongs to which blood group? Very simple. Hana, you have your plasma antigen, and against of that you have antibody of it. Hana. So if a person is having antibody A in plasma, then belongs to which group? Very simple question, guys. Right? Very simple question. A, B, or O? Hmm. Very simple question. Pooja or Hebel Chotrika B. Yes. If a person is having anti-A antibody means it is having B blood group, right? Very nice. So this is your important table. You have to learn it. All right. So in which the universal recipient, right? Universal recipient, this one, and universal donor. Universal donor DONOR. DONOR. To be precise, O negative, right? O negative is your the universal donor, okay? Whereas AB positive is your universal recipient, okay? So, which event is associated with expiration? Relaxes of diaphragm, relaxation of diaphragm and external intercostal muscles, okay? Contraction of diaphragm and external intercostal muscles. Mm, increased thoracic volume and raised sternum, air entering lungs and ribs are raised. Which one is it, guys? Chalo, come on, fast. Which event is associated with expiration? I'm talking about expiration. Expiration. Relaxes of diaphragm and external intercostal muscles. Contraction of diaphragm and external intercostal muscles. Increased thoracic volume and raised sternum or air entering lungs and ribs raised. Chaitanya is right. That's your A. Relaxation of diaphragm and external intercostal muscle. Very good. Very good. Very nice. So, which structure contains corpora quadrigemina and cerebral pedunculus? Okay, here you got the question. That which structure contains corpora quadrigemina and cerebral pedunculus, right? So, is it going to be a forebrain, midbrain, cerebellum, or medulla oblongata? Hmm. Which one is it, guys? Which structure contains corpora quadrigemina and cerebral pedunculus? Forebrain, midbrain, cerebellum, or medulla oblongata? Which one is it, guys? Chalo, come on, fast. Hmm. That's going to be your midbrain, okay? So midbrain may you can say forebrain, prosymphalon, midbrain, mesymphalon, and hindbrain is your rhombus cephalon, right? Whereas in midbrain you can see midbrain may you have pedunculus and corpora quadrigemina. Okay. Now here are some abnormalities with their meaning. You have to just match out the things. Okay, ageusia, hypogeusia, dysgeusia, or taste blindness. Okay, so these are all related to the taste, right? Ageusia, hypogeusia, dysgeusia, taste blindness. So let's start then. Here you can see ageusia. Ageusia means loss of the taste sensation, right? And hypogeusia, hypo means the lower, lower means decrease, right? So dysgeusia means disturbance of the taste. Right? This and this. Taste blindness, loss of ability to the recognize substances. So one ka D, two ka A. So here you got the correct answer, right? Yes, here got the correct answer. Chalo, right. All are true regarding muscle contraction except myosin head splits ATP, cross bridge formation occurs, power stroke shortens sarcomere, or detachment occurs without ATP. Hmm. Except they have asked, right? Except they have asked. Myosin head splits ATP, cross bridge formation occurs, power stroke shortens sarcomere, or detachment occurs without ATP. Yes. Chalo, come on, fast. Nobody's replying, huh? That's your D. Detachment occurs without ATP. That's a wrong statement. Whereas myosin head splits ATP. Yes, that's right. Hana. And cross bridge formation occurs. Yes, that's right. Power stroke shortens sarcomere. Obviously, that's going to be right. Detachment occurs without ATP. No, detachment requires the ATP. Okay. Chalo. Next one. Stapes is a which type of bone? Stapes. है ना manus incus stapes है ना you can learn it through miss right manus incus stapes right so these are the bones which are of first of all these are of which bone guys can you tell me which are these are which groups of bone where do we found these bones and is it going to be your longest bone smallest bone funny bone or strongest bone of a man hmm. Yeah, that's going to be your smallest bone. Miss bone, that's right. But I'm asking, these bones are found where in our body? I'm talking about manus, incus, and stapes. Yeah, where do we find this one? Hmm? Ear. Yeah, that's right. That's right. Pharma knowledge with Pushparaj. Ear. Ishwara ear. That's right. And longest bone, femur. Very good. Very good. Chalo guys. Here you can see total bones. We do have 206. Longest and strongest bone, femur. Smallest bone, stapes. Funny bone, humerus. Largest vertebra, lumbar. Skull, dicondylar 2 Ribs में we do have 12 pairs. First to 7th we do have true ribs. 8th to 10th false ribs and 11th to 12th floating ribs. Right? Chalo. Inability of the brain to produce which of the following is said to cause Parkinson disease? Array. Very simple. Very simple. Parkinson disease, you know that's a neurodegenerative disorders, right? What does it happen into the Parkinson? Your neurotransmitter level decreases. Which neurotransmitter level decreases? Thyroid stimulating hormone level decreases, cortisol level decreases, prolactin level decreases, or dopamine level decreases? Very simple question, guys. Chalo, tell me first. Tell me first. That's your very good. Navneet and Ishwar, that's your right. Dopamine from the nigrostriatal pathway into the basal ganglia, right? Nigrostriatal pathway, right? Nigrostriatal pathway and in basal ganglia. In basal ganglia, dopamine levels decreases. Yes? Chal. Which hormone is not secreted by stomach? Somatostatin, glucagon, gastrin, or ghrelin? Chalo, come on, fast. Come on. Hmm. Which of the following hormone is that does not release from the stomach, guys? Stomach. Hmm? Somatostatin, glucagon, gastrin, or ghrelin. Which one is it? Which one is it? Hmm? Somatostatin. Nisargaloge is saying somatostatin. No, it's not. Somatostatin is released by stomach as well as the your pancreas, but glucagon is not. Yes, Chaitanya is right. That you can see the glucagon is secreted by the alpha cells of pancreas, right? Alpha cells of pancreas say you will have your glucagon. All right. So this is not secreted by the stomach. Okay. Chalo. Rise in FSH and LH mainly occur during. Okay. FSH and LH occurs mainly during. FSH is your follicle stimulating hormone and LH is your luteinizing hormone, right? So occurs mainly during in menstrual phase, follicular phase, ovulatory phase, or luteal phase. Hmm. Very simple question. Very simple, guys. Very simple. Chalo, come on, fast. Tell me. Tell me the answer of it. FSH and LH. डेल्टा सेल से डेल्टा सेल से सोमैटोस्टैटिन निकलता है पुष्पराज. Alright, from delta cell somatostatin is being secreted, not glucagon, right? Chalo, this one, rise in FSH and LH occurs mainly during menstrual phase, follicular phase, or ovulatory phase, or luteal phase. That's your ovulatory phase, guys. And when the egg is being formed, that's your ovulatory phase, right? Chalo. 50 days, 50 model paper. I hope you are doing your mock test each and every day and consolidating the concepts day by day, right? So, which statement is not correct regarding the waves of ECG? Okay, not correct. T wave represents ventricular repolarization. PQRS-T. T ventricular repolarization. That's right. QRS complex represents ventricular depolarization. That's right. ST segment represents atrial depolarization. PR interval includes AV nodal conduction. Chalo, fine. Which is not correct, guys? Which is not correct? Hmm? Which is not correct? Very simple question. Yeah, none of you are replying me over here, huh? Which statement is not correct regarding waves of ECG? That's your ST segment required represents atrial depolarization. That's a wrong one. Here you can see this one. P wave is for atrial depolarization. QRS complex ventricular depolarization. T wave ventricular repolarization. That's it. Now intervals की बात करते हैं. तो PR interval atrial depolarization and conduction through AV node, right? QT interval electrical activity in ventricle and ST segment is your isoelectric. Very simple. I don't know what are you doing, guys, over here, na? Given below are two statement. One is labeled as assertion, another is labeled as the reason. Okay. So assertion is lymph is a clear and colorless liquid. It is formed from blood plasma leaking through capillary walls. Okay. Yes, that's right. Lymph is a clear and colorless liquid. Lymph node, obviously, lymph node में से lymph निकलता है ना, lymph fluid, lymphatic fluid, right? So it is formed from the blood plasma leaking through capillary walls, right? Okay. Both A and R are true, and R explains A very well. That's why first option is your right. The swelling between skin and muscle is seen in. Okay. Muscle and skin is seen in lymphedema, lymphadenitis, splenomegaly, lymphangitis. Hmm. दे दे रे. दे दे रे. Explain briefly about this one, pharma knowledge. What is de de re? What is the trick of de de re? Huh? Swelling between skin and muscle is seen in lymph. edema, right? Edema is itself a kind of the swelling, isn't it? Chalo. Lymphangitis, inflammation of lymph vessel. Lymphadenitis by lymph nodes, right? Lymphadenopathy, enlargement of the lymph nodes. Splenomegaly, enlargement of spleen. Lymphedema, swelling caused by buildup of lymph fluid in the body between the skin as well as the muscles. Okay, chalo, next one. Transport of food through digestive tract is mainly assisted by. Chalo. Transport of food. You have just taken your dinner right now. Maybe you have taken your dinner and now it is going across the digestive tract, right? So it is mainly assisted by which kind of the muscles? Is it going to be your skeletal muscles, cardiac muscles, visceral smooth muscle or voluntary muscle? तो पेट में तुम्हारे स्टमक में स्केलेटल मसल होती हैं क्या? डू यू हैव स्केलेटल मसल्स इन योर स्टमक? नो. कार्डियक मसल्स? नो. Visceral muscles? Yes, obviously. Voluntary, can you able to control your muscles into the stomach? Hell no. So what's left? Visceral muscle contraction. Simple as that. Yes, chalo. Which of the following lipids are directly linked to the atherosclerosis? Okay. Now atherosclerosis is the plaque buildup, right? It is what? Atherosclerosis, for example, this is your vein, right? This is your vein and blood is being flowed. But atherosclerosis is this one. This one means here you have plaque. That is for fat deposition, right? Fat deposition. Okay. So this is your atherosclerosis. But which of the lipids are directly linked to that? HDL, LDL, triglycerides, all of the above. Yeah, that's your LDL, which is a bad cholesterol, right? It gets deposited into the veins, whereas HDL is a good cholesterol, which transports back the cholesterol from the tissues into the blood. All right, chalo. Maximum condensation and arrangement of chromosome at the equator. Okay, equator means in between, right? In between. Middle. So occurs during prophase, metaphase, anaphase, or telophase. Chalo guys, tell me fast. This is the very simple, na? Maximum condensation and arrangement of the chromosome at the equator. Equator means simple, na? At the midline. Occurs during prophase, metaphase, anaphase, or telophase. Which one? That's going to be your metaphase. That's right, Chaitanya. Huh? Okay. Now, decrease in absolute neutrophil count in peripheral blood is seen in, okay, leukopenia, leukocytosis, leukemia, or granulocytopenia. Okay, chalo. First of all, neutrophil is your granulocyte, right? That's it, your granulocyte. Whereas mia means increased. Right, Mia means increased, whereas Penia means decrease. Right. Now tell me. Now tell me, guys. Neutrophil is a granulocyte. So granulocytopenia. Yes, you have got right, Magesh. Now, yes. So D is your granulocytopenia. That's right. Okay. Chalo. Blood returning from the lungs first enters in. Okay. Blood returning from the lungs पल्मोनरी आर्टरी से चला गया उधर लंग्स की तरफ, है ना? द ब्लड हैज गॉन इनटू द पल्मोनरी आर्टरी. Blood returning from the lungs first enter in. Okay, pulmonary artery say, I think right ventricle. Yes, right ventricle. Here you can see like this one. This is your heart, right? And this is your chambers, and here you have got the pulmonary artery. And again you have this one, right? So here you have pulmonary vein. Yes, the pulmonary vein say back into the uh, left atrium. Yes, the right atrium through vena cava. No, right ventricle through pulmonary artery. Left atrium through pulmonary vein. Yes, that is right. That is right. Here you can see left atrium. This is your left atrium, no? Right atrium, left atrium, l- uh, right, uh, sorry, left ventricle. क्या कर रहा हूँ मैं? Right atrium, right ventricle, left atrium, left ventricle, right? So here you can see left atrium है ना? Left atrium में you will have your pulmonary vein just after the lungs. So this is your correct option, right? Okay. चलो. The volume of air that remains inside lungs at the end of maximal forceful expiration. Forceful expiration. Like this. The volume of air that remains in that. What is that? If something is remain, that is what? That's your residual, right? So residual volume. The volume of air that remains inside lungs at the end of the maximum full force contraction, that's your residual volume. Okay, this one is very much important, guys. Pulmonary air volumes. You should be learning this one, all right? Chalo. So this is your GPAT 2026 special edition GDC weekly test. I think all of the syllabus, I think all of the types of the GDC special edition weekly test have been done right now. I hope you have done it very well, and I hope you will be doing your uh, preparation in a very good manner. The middle ear opens into nasopharynx through. Okay, the middle ear opens into nasopharynx through cochlear duct, semicircular duct, external canal, or eustachian tube. Which one is it, guys? Which one is it? Hmm. The middle ear opens into nasopharynx through cochlear duct. Obviously, no. Semicircular canal, external canal, or eustachian tube. That's your eustachian tube, which is open the middle ear into nasopharynx. That's right, Pooja. Very good. Anna? Okay. All of the followings are action of the sympathetic nervous system except. Sympathetic means flight and fight mode. Flight mode, that's an emergency mode, right? So which of the followings are not are except, they have asked. Except means which is not of sympathetic condition, right? Dilated bronchioles, obviously, if you see lion in front of you, your eyes will be dilated to see that one. है ना? Sorry, dilated bronchioles. Dilated bronchiole means कि your bronchiole is being dilated and you are running. You are running faster. You are running faster and you need a lot of oxygen inside to run faster, isn't it? So dilated bronchiole. Second thing, increased peristalsis. No, you don't have time to pee at that time. Two number, no. You don't have the time to do two number in front of the lion. So increase peristalsis? No, this is not the thing. Increase heart rate, that's right. Increase epinephrine release? Yes, adrenaline in your veins would be increased. But B, increase peristalsis, that's a wrong option. Okay. So a patient has uric acid deposition in joints with redness, swelling, and severe pain. Okay, uric acid deposition, guys. Uric acid deposition diagnosis: a gout, osteoarthritis, rheumatoid arthritis, or synovitis. Which one is it? Very simple. Very simple. A patient has uric acid, so obviously that is quite related to the gout. But can anyone tell me the drugs which are increasing the excretion of uric acid? Hmm? The drugs which are known to be increasing the excretion of uric acid, guys. And also tell me those drugs which inhibit the synthesis of uric acid. Give me the trick, what I have told you in the class. What I have told you in the class, give me the trick over there. Next one. Which are the following functions? I know that's 𝘂𝙎�〖𝘂𝙎�〖, Magesh, but I need example of the drug, no? Which of the following function is not regulated by adrenocorticoids? Allopurinol is a synthesis inhibitor or 𝙂𝙋𝘎𝑃? Name the drug which is 𝙂𝙋𝘎𝑃. Which of the following function is not regulated by adrenocorticoids? Adrenocorticoids, okay. Fat metabolism regulation, protein metabolism regulation, carbohydrate metabolism regulation, involuntary muscle movement. Nobody knows 𝙂𝙋𝘎𝑃 drugs? Seriously? Huh? Come on, guys. Which of the following is not a sexually transmitted disease? Muscular dystrophy, syphilis, gonorrhea, warts. Muscular dystrophy, how it can be a sexually transmitted disease? Muscular dystrophy means your muscle cells have gone, right? So, syphilis, yes. Treponema pallidum, gonorrhea, yes. Warts, yes. Muscular dystrophy, that's not. Which structure is not a part of the male reproductive system? Prostate, testis, penis. These three all are your reproductive system. Cervix is into the female reproductive system. Magesh, don't you know that? 𝙂𝙋𝘎𝑃 1, Naveen, Pooja, Nisarga Logesh. Don't you know about this one? 𝙂𝙋𝘎𝑃 drugs. Proben acid, febuxostat, and acute management drugs. Sulfenpyrazone, proben acid. Xanthine, sir. Very nice. Which of the following cell organelles? I'm asking about the 𝙂𝙋𝘎𝑃, and you are febuxostat, proben acid. USP, 𝙂𝙋𝘎𝑃. Sulfenpyrazone and proben acid is for the 𝙂𝙋𝘎𝑃. Febuxostat, USP, sorry, na. So sulfenpyrazone as well as the proben acid is your 𝙂𝙋𝘎𝑃, whereas the allopurinol and febuxostat is your synthesis inhibitor, right? Chalo. Next one. Which of the following cell organelle is called as post office of the cell? Post office means the packaging line, right? Nucleus, lysosome, Golgi apparatus, or mitochondria. That's obviously your Golgi apparatus, right? Nucleus, brain of the cell. Lysosome, societal bags. Golgi apparatus, post of the cells. Post office. Mitochondria, powerhouse or power plant of the cell. Ribosome, protein factories, right? Chalo. Rash and Steven-Johnson syndromes are examples of. Rash and Steven-Johnson syndrome are examples of IgE mediated hypersensitivity, cytotoxic antibody mediated hypersensitivity, immune complex mediated hypersensitivity, or T cell mediated hypersensitivity, guys. Which one? Rash and Steven-Johnson syndrome. This one I have told you in general pharmacology classes as well. Rash and Steven-Johnson syndrome are example of which kind of hypersensitivity, guys? Ishwar, Nisarg Logesh, Magesh. Rash and Steven-Johnson syndrome. Do you know about this? These are the examples of which kind of the hypersensitivity reactions? Hypersensitive 1 reaction, 2 reaction, 3 reaction, or 4th reaction? Hmm? Wow, nice, Pooja. Very nice. Very nice. Apart from you, no one gonna answer, isn't it? Fine, guys. T cell mediated hypersensitivity is responsible for the Rash and Steven-Johnson syndrome. Which of the following is the most outermost cranial meningeal layer of the brain? Dura mater, pia mater, skull, or arachnoid? That's your dura mater. Okay. Durameter. Wow, Makesh, very nice. That's what I expected from you, no? Very nice. I don't know how many times I have taught this to you, that hypersensitivity reactions are very much important, even through a trick I told you about this one, but no one knows the answer. Isn't it, Ishwarana? Ishwarana, don't you know about that one? Hmm? Still, no worries, guys. No worries, no worries. No worries. It doesn't make any sense, Magesh, to delete the comment section, right? To delete your comment. It doesn't make any sense. Patella is an example of long bone, short bone, or flat bone on sesamoid bone. That's your sesamoid bone. Okay, sesamoid bone is your triangular like of a shape. Okay, triangular like of a shape, and that's your patella. Patella is your kneecap. All right. Chalo. Which uterine layer shows strong contractions during delivery? Okay, so uterus have plenty of the layers, right? So during the contraction, during the time of the delivery or labor, right? So, which layer generally have a strong contractions? Endometrium, myometrium, perimetrium, or epithelium? Yeah, that's your myometrium has strong contractions during delivery. Okay, chalo. The amount of air that moves in or out of the lungs with each respiratory cycle is expiratory reserve volume, tidal volume, inspiratory reserve volume, or residual volume. That's your tidal volume. Okay, chalo. So this table is very much important, guys. Do note it down because this is important. Okay. Now, which of the following is not a bone in the legs of the human body? Okay. All of the four are the bones of leg, but one is not. Radius, tibia, femur, or fibula. Which one is it? Which one is it? Which one is it, guys? Which one is not a bone of a leg? Nobody knows. Nobody knows. This much time you have to take, isn't it? Radius. Radius. Here you have, right? Which of the following is a part of the digestive system as well as the respiratory system? Okay. Trachea, pharynx, larynx, or none of these. Trachea is this. Larynx is your windpipe. Pharynx is the part of the respiratory system, whereas the food pipe as well. Right? Which of the following enzymes is active at the 7.6 pH? 7.6 pH, guys. Which of the following enzyme gets activated at 7.6? Renin, sucrase, pepsin, or lipase? Hmm? Which one is it? That's your sucrase, okay? Chalo. Which white blood cell is associated with allergic response and antihistaminic properties? Allergic reactions. है ना? Sometimes they used to say the patient is very eosinophilic. The patient is very eosinophilic. That's why it has a lot of allergic responses. है ना? And the patient is taking antihistaminic. That's your cetirizine, levocetirizine, fexofenadine, montelukast, they have been taken all of the time if they are very much prone to allergic responses. So, which cells against these allergic responses do come? That's your neutrophils, basophils, eosinophils, or agranulocytes. Naveen, that's your eosinophils. All are included in pectoral girdle except what is your pectoral girdle, guys? Pectoral girdle is your this one area, right? This area. So all are included except clavicle. Clavicle is your this one, no collarbone, which is also known as the beauty bone. Scapula, behind acetabulum and glenoid cavity. What is glenoid cavity? Glenoid cavity is this one, okay, in which the humerus balls, or you can say the ball wala jo portion hai of this one humerus wala part will be going fit onto this part, and this is the glenoid cavity. So in the same way, we do have pelvic region where the femur has a ball system and get fitted into that one. That's a acetabulum, right? So acetabulum is present into the pelvic girdle, not pectoral girdle. Okay, acetabulum is present into the pelvic girdle, right? Pelvic girdle, not pectoral girdle. Clavicle is there, scapula is there, and glenoid cavity is there. Okay, sure. Match the following cranial nerve with their function: oculomotor, trochlear, abundance, hypoglossal. Hmm. Oculomotor, trochlear, abundance, as well as the hypoglossal. Chalo guys, come on first. That's your oculometer. Obviously, that's going to be your eye movement, isn't it? That's going to be your eye movement. Hana? Trochlear is your vertical eye movement. Trochlear. Trochlear. Abundance is your lateral movement of the eyeball, and hypoglossal obviously your टंग मूवमेंट राइट. सो 4 का हो गया तुम्हारा डी, तो 4 का डी, 4 का डी, 4 का डी. ऑक्यूलर का हो गया आई मूवमेंट, पीपल डायलेशन राइट. 1 का सी, दैट्स योर सी ऑप्शन राइट. चलो. Scala tympani is the part of, scala tympani is the part of internal ear, middle ear, endolymphatic sac or brain. Which one is it guys? Internal ear, middle ear, endolymphatic sac or brain? Hmm. Which one is it? No one is going to answer, right? Internal ear. Sebaceous glands are apocrine, mesocrine, or holocrine. What is that? Apocrine, mesocrine, holocrine, or none of these? Fine. Holocrine. Okay. Here you can see sebaceous gland through which the sebum is being secreted, right? Oil glands. These are also known as the oil gland. Secretes the sebaceous gland, are holocrine gland, and salivary glands are the merocrine glands. The first hard sound, lub, is produced due to the closure of atrioventricular valves, semilunar valves, pulmonary valve, or aortic valves. Which one is it, guys? First hard sound, that's your love. And second is your dub, love, dub, love, dub, love, dub. So is the closure of which one? Atrioventricular valves, semilunar valves, pulmonary valves, or aortic valve? That's your atrioventricular valves. Okay, this one is important. They can ask this one. Okay, sure. Which condition can be treated by replacing the lens with an artificial lens? Okay, replacing the lens. Natural lens of the eye is being removed with an artificial lens. Which is this one? Prebiopsia. Prebiopia is your short sightedness in which you won't be able to see the objects nearby your vision. That's your prebiopia. Presbyopia. Okay, presbyopia. Presbyopia is the combination of myopia and biopia. Heteromyopia, sorry. Yes, myopia and heteromyopia. Myopia is your nearsightedness, and heteromyopia is your farsightedness. Whereas presbyopia is a combination of both. Okay, so cataract, color blindness, glaucoma. Cataract, color blindness, mein you don't changes the lens. Cataract, mein yes. Cataract, mein you do. Cataract may replace the lenses. Nobody knows the answer, isn't it? Anna, this much hard it is, no? Everyone, this much it is hard. You don't know the answer about this. Even you'd never had seen any patient in your family whom is suffering from the cataract and talking about the uh, lenses in it, isn't it? Fine. Lymph carries digested and absorbed fat from stomach, small intestine, colon, or esophagus. Lymph carries digested and absorbed fat from stomach, small intestine, colon, or esophagus. That's your small intestine, guys. Okay. So, tunica media is a thick and composed of elastic and smooth muscle tissue in veins, capillaries, arteries, or venules. That's your arteries which have the tunia medica media. Sorry. Penetration of corona radiata by sperm is mainly facilitated by penetration of the corona radiata by sperm is mainly facilitated by ligase, oxytocin, androgamon, or hyaluronidase. 𝘂𝙀𝙎𝘾𝙀𝙍, very nice. Vital capacity of lung. Vital capacity of lung. This question has been asked before. TV plus IRV plus ERV. TV plus IRV plus RV. TV plus ERV. IRV plus ERV. Vital capacity means the how much amount of the volume of the air that you can um, hold in your lungs. That's your vital capacity, right? So that's going to be your tidal volume, inspiratory rate volume, expired rate volume, everything involved over there. Okay, amount of air which can be inhaled and exhaled with maximum effort. That's your vital capacity. Mark the incorrect statement about the prostate gland. Okay, locates superior to the urinary bladder. Urinary bladder के superior होता है. अच्छा. Secretion is thin and milky colored. Okay. Secretions produce nutrition for the sperm. Function in increasing the mobility of the sperm. Which one is incorrect, guys? Which one is incorrect? Located superior of the urinary bladder or anterior of the inferior of the urinary bladder. That's your inferior. Okay, it's not located on the superior side. The inferior side. You can see this is your urinary bladder, and you just can see that prostate is quite inferior, means downwards, isn't it? So the cells forming the epithelial of Bowman capsule are known as mesangial cells, juxtaglomerular cells, podocytes, squamous epithelial cells. Hmm? Mesangial cells, juxtaglomerular cells are present in the kidney in which renin is being released. Renin is responsible for the elevation of blood pressure, blood volume, right? So that's going to be your podocytes, guys. Juxtaglomerular cells कहाँ से आ गया पूजा? Largest organ in the body, liver, skin, bone, lungs. चलो, come on, fast. इसका आंसर तो दे दो, guys. This question is very much simple. Hmm? Largest organ in the body is that's your skin. Okay. Number of spinal nerves in human is number of spinal nerves. I'm not asking about the spinal cord. I'm not asking about the vertebrae of spinal cord. I'm asking about the spinal nerves. That's your 31. Okay. Here you can see spinal nerves. Cervical spinal nerves 8, thoracic 12, lumbar 5, sacral 5, and coccygeal is your 1. The total is becomes 31. Thank you so much, guys, for joining the session and all the very best for your preparation. I hope your preparation is going good and don't worry about the marks, whatever you're getting right now. Just be consistent over your mock test examination. See where you are getting wrong and start studying those things in which you are getting wrong, and also study those things as well on which you are not being able to attempt the questions, right? So that's all from my side, and thank you so much for joining, and all the very